News 3, taking action for your health. We are joined by two well-respected physicians. Dr. Danny Avula is with the Virginia Department of Health, and he is running the vaccine rollout for the Commonwealth. Dr. Edward Oldfield is an infectious disease specialist with Eastern Virginia Medical School.
They are taking your questions about the vaccine rollout. Thanks so much for joining us. Let's get to our next question. All right, this video question is from Adele Hodges. He is having trouble registering because he says he is not technologically savvy.
I'm trying to register to get the shot, and you get on the line and they say go to such and such site and go here and go there, and I don't know anything about this computer stuff. And if you're not technology oriented, it's like if you don't know how to read and write. And I think there should be a place where they will help people like me to register and get the shots.
So Dr. Avula, is there help available for people like Mr. Hodges?
Yeah, absolutely. Help is on the way, Mr. Hodges. I think what you're voicing is something we've heard from around the Commonwealth, and really, in the beginning of this, local health departments were managing the small amount of vaccine that was coming in for the small populations they were able to vaccinate. And what happened when we moved into 1B, we completely overwhelmed the local public health infrastructure by adding so many eligible individuals. And so we've had to build up the capacity to respond to that. This week, we will be rolling out a centralized call center where they will be able to walk you through the process and actually pre-register you so that you don't have to go to sites and figure it out on your own. We recognize there are many, many residents that need that support. And so it is coming any day now.
That will be a relief to many, many viewers who can better use a phone rather than a computer. Thank you for that, Dr. Avula. Well, this next question goes to Dr. Oldfield about side effects after the shot. Many people curious about this. This was emailed from Anthony. Here's the question. If you take the first COVID vaccine shot and you get symptoms like nausea and headaches, can you take medicine to alleviate them? And should you take the second shot if symptoms are severe? Dr. Oldfield.
The recommendation is don't take Tylenol or Advil before the vaccine because it may interfere with your body's protective response to the vaccine. But after you've had the vaccine, if you get muscle aches or fever or chills, you certainly can take Tylenol or something like Alleviate to decrease those symptoms. And it's been suggested that you may have a little more symptoms for the second dose. But like I said earlier, I really had no problem at all with the second dose. So I would go ahead and just tough it out if I had some significant reaction to the first dose, as long as it wasn't really severe, because getting COVID is really terrible. Far more than 24 or 48 hours of muscle aches and chills. And usually these side effects only last a day, sometimes a little more, but that's really about it overall.
Thanks, Dr. Oldfield. Now, this question is from Nikki, and she says, how would the vaccine affect breastfeeding mothers and their child with known allergies? Do you think the vaccine is safe for breastfeeding moms? I have been eligible to receive the vaccine now for about 2 months, but I refuse because of the lack of information on this topic. Dr. Avula?
Well, there hasn't been a ton of data gathered around breastfeeding mothers. During the trials, there were a number of women who became pregnant during the period in which they were testing Moderna and Pfizer. But really, the way that the vaccine works, again, as Dr. Oldfield mentioned earlier, we're not introducing any live virus at all. It's a very safe vaccine. And so the current recommendation is that both pregnant and breastfeeding mothers should take the vaccine, as getting COVID is clearly a higher risk scenario than any small side effects that might come from the vaccine.
All right, this question from Deborah. What is the reason 1B with high-risk health issues, age 62, are not being vaccinated by CVS? She says, I have been on Virginia Health Department looking for a solution to this since January 12th.
So when CVS entered through the Part 2 retail pharmacy partnership, they agreed because we had such a large backlog of individuals who are 65 and over, they agreed to focus their efforts on the 65 and over population. And when you look at the data, there are few things that pose higher risk for severe COVID consequences than age. For example, compared to a healthy 20 to 30-year-old, if you're 65 to 74, you have a 90 times greater chance of dying if you were to contract COVID. If you're 75 to 84, that number jumps to 220. And so age is really a significant risk factor. We also are trying to work through individuals who have severe underlying conditions. There's a large number of those that are on the CDC guidance, and we're really trying to narrow that down for the state right now so that we can figure out, what is higher risk, somebody who currently has cancer or somebody who is, perhaps a 45-year-old with asthma. And so right now that's being left to the clinical judgment of providers that are actually offering the vaccine, but we hope to have more specific guidance around that soon.
How soon is soon?
I would say by next week, but I think there still is the issue of supply, right? When you only have about 130, maybe a few more doses coming in, it is going to take us a very long time to work through that 1B population. And I think realistically, that's 2 to 3 months before we finish 1B. So what I hope that people understand in our supply conundrum is that even if you are eligible for 1B, it will likely be 2 to 3 months before you have an opportunity to get vaccinated.
All right, thank you, Doctor. More of your questions and answers from our doctors straight ahead on the other side of the break. Back, we're sharing your questions about the vaccine rollout with Dr. Danny Avula with the Virginia Department of Health and Dr. Edward Oldfield with Eastern Virginia Medical School.
All right, let's get right to our next question. Now, this question comes from Dennis in Chesapeake. He wants some clarity on which vaccine is being given.
Well, my concern is how do you know which one you're getting? And then is any of it actually, are they all working? You know what I'm saying? Some people have to get double doses, some people aren't, but getting one. So my question is, which one are we getting when we walk in? Are they letting us know?
So right now, there are 2 different vaccines that are approved for use. Both are 2-dose vaccines. One is made by a company called Moderna, the other by a company called Pfizer. Both of the vaccines are extremely effective, 95% effective, and extremely safe. Now, there are other vaccines coming down the road, some of which are 1-dose vaccines that have lower effectiveness rates. Right now, the choice of where Moderna and Pfizer is going really just depends on some logistical factors, like the ability of a provider to actually store the Pfizer vaccine, which requires -90-degree ultra cold storage. And that distribution isn't really based on any other factors. As we move forward, as we offer vaccines that maybe have a different efficacy profile, we will make sure that people have the choice and understand what they're signing up for in the beginning of that. But right now, you're either going to get Moderna or Pfizer until there are new vaccines on the market.
All right. Dr. Oldfield, here's another one for you about reaction after the vaccine. Elizabeth in Chesapeake says this. She says she's suffering from something called COVID arm. And here's her question. I got my first Moderna vaccine on January 27th. On February 5th, I developed a rash at the injection site. It's oval-shaped, red in color. It's hot and it itches. Today is February 10th, and the rash has grown larger in size. I am currently taking Benadryl. Is it safe to take the second dose, Dr. Oldfield?
So this is a side effect that has been reported, a delayed response with a very localized inflammatory response. And again, I think that's a marker of your body making a really strong response to the vaccine. I would discuss that with your primary. They might even consider not just Benadryl, but maybe a steroid cream to put onto the site. And it would depend on how long this stays, whether I might wait a while before I got the second dose, a little longer. Usually with vaccines, if you wait longer than the specified which is 28 days for the Pfizer and 21 Moderna, they actually work better. So if you wanted to see what happens with your arm, discuss it with your physician, and then wait maybe 6 weeks, I think that would be quite reasonable.
Thank you, Dr. Oldfield. You'll want to stay with us as we take more of your questions about the vaccine rollout coming up next.
Welcome back. We are continuing to get your questions answered about the COVID vaccine rollout.
Dr. Danny Avula with the Virginia Department of Health and Dr. Edward Oldfield with EVMS have been answering your questions about the vaccine rollout all afternoon. And Barbara, we have gotten some great questions, some wonderful answers, some insight into some of the questions that our viewers have been asking.
Yeah, many of them we're really curious about too. We have our doctors on standby, but let's review some of what people have been talking about. They've been talking about how, they're concerned about all of the delays, and then Dr. Avula explained to all of us that it's all a matter of how many vaccines are given to each state, and the goal is to, distribute about 130,000 of those vaccines throughout the state. And now for this question, Bev.
Right. This is from Matilda. She's from Chesapeake. And she wants to know, can someone who has been vaccinated be a carrier for the disease and then transmit it to someone who has not yet gotten the vaccine? Dr. Oldfield?
That's a very good question. The studies were done looking solely at people with COVID who had symptoms. So it was symptomatic COVID. And it's 95% effective at preventing symptomatic COVID, but they did not look in a very rigorous way at asymptomatic infection. And it looks like the vaccine may be about 75% effective against asymptomatic infection. Of course, people without symptoms can transmit the virus. So that's why we recommend that people continue to wear a mask and social distance, even after they've had the vaccine, because we just don't know all the answers about asymptomatic infections in vaccinated people.
Okay, that's good to know. Here's a two-parter from one of our viewers, Maravilla. Her question is, if two people who do not live in the same household have both been fully vaccinated, at what point can they safely not wear masks when only in the company of each other? And at that point, will it be safe for fully vaccinated persons to stop wearing masks when going out into public, not crowded places, or when in the company of others? Dr. Oldfield.
Yeah, I would still be wearing my mask even with having received both vaccines. I think as we get more comfortable with this idea of the 95% protection from symptomatic infection, then I think we're going to see more ability to get with other people not in our household unit. I know in some of the retirement communities, they're now allowing bridge players. So 4 people at the table, as long as all 4 are vaccinated. So I think as we become more comfortable with how effective this vaccine, I think we're going to loosen up a little bit. But for right now, I personally am still doing everything I did before I had 2 doses of the vaccine. And I think over time, I'm probably going to loosen up a little bit as we get more information.
Thanks, Dr. Oldfield, and thank you to our doctors for helping clear up some issues surrounding this vaccine. And Dr. Danny Avula from the Virginia Department of Health, and you just heard from Dr. Edward Oldfield with EVMS.
And thank you, all our viewers, for all these great questions. You'll find more answers and our link to all of our coverage on the vaccine rollout on WTKR.com.
And we are back with Patrick Rocky's forecast right after the break.